It's New Hampshire Now on WKXL 103.9, 1450 and ConcordNewsRadio.com. I am Chris Ryan. I want to thank you so much for joining us on the program today. We'll be out in Los Angeles for the NBA Finals beginning tomorrow. Joining us on the program right now is Jim Steele. He's the owner of Senior Helpers in Londonderry. And as a part of the healthcare reform bill, which we've obviously talked a lot about on the program over the last little bit, you can check the archives to hear about that. But as a part of that, there is the CLASS Act, which is the Community Living Assistance Services and Supports Act, the nation's first public long-term care insurance program that deducts from Americans' paychecks now to pay later for the often crushing costs of long-term care. And joining us to talk about that right now is Jim Steele. Mr. Steele, thanks for joining us on the program.
Good morning, Chris. And
first off, tell us a little bit about what this means and what it means for seniors and for people who are preparing, and nobody wants to prepare to be in an assisted living community, but I guess it's kind of a fact of life. What does this mean?
Well, it means the donut hole shrunk a little bit. Many of us have heard of the donut hole, but for those of us who have not, it's a term used in the senior care industry that describes people who have too many assets to be eligible for Medicaid assistance and not enough assets to pay for their own care. And what this helps to do is to fill that gap by allowing one to begin preparing for it at a very low cost early in their working careers until the time that they need some type of assistance in managing what we call the activities of daily living. There's money available to pay for that. So, as you mentioned, it's a voluntary, federally administered consumer finance. The government doesn't pay for this. All it does is administer the trust fund. And how it's supposed to work, being that it goes into effect in 2011, is that you pay a small monthly premium throughout your working life. And if you start out young, your premiums will be lower, and if you start out older, your premiums will obviously be a little bit higher. But they should average anywhere from $60 to $120 a month. If there's ever a need for the services, then you get about $75 a day in benefit, or more or less, but the average is expected to be about $75 a day.
Any idea as to the cost that an individual bears? And obviously Medicare and Medicaid pick up for some people, as you mentioned, and there is the donut hole for people who do not qualify for that or qualify to a limited degree. Is there any idea as to what the cost is per year, just to give an idea to listeners or to people who are approaching those years as to how much it costs out of pocket on an average for an individual?
Well, for in-home care, you can spend around $20,000 a year. For assisted living, you can spend $75,000, $80,000 a year. And for nursing homes, you can spend well into the hundreds of thousands of dollars a year. If you break that down into day costs per day, a nursing home costs nationwide, and I'm sure New Hampshire is a little bit higher than the national average, given that that's what our demographic is in this area. But nationwide, the national average is about $219 a day for nursing home care. And with assisted living, it's about $100 a day. So what the CLASS Act does is defray those costs significantly by, if you consider an average daily benefit of $75, and if you're looking at assisted living as, say, $105 to $150 a day, it can cut your assisted living costs in half and significantly reduce your nursing home costs. As far as in-home care, it can completely cover some levels of in-home care.
Now, this sector is going to be a huge industry as the baby boomers continue to age, as we're speaking with Jim Steele, the owner of Senior Helpers in Londonderry. As the baby boomers continue to age, this, as I mentioned, this is going to be there's going to be an overwhelming need for the types of services that this is going to deal with. What is the industry prepared to deal with that, and what will this do? Will it be able to defray or handle that cost entirely? And is this sufficient to deal with that overwhelming burden that the country is going to have to bear in terms of the cost of dealing with and helping these seniors, these baby boomers through their senior years?
Well, now you get into the arena of future casting, but I can tell you now that the general consensus here in New Hampshire is there's a growing need and a shrinkage of resources available to cover that need. And the Department of Health and Human Services here in the state of New Hampshire is going through a rather cathartic transition, as we all know, as the state budget gets worked through. Well, let's just say that there's a lot of concern for how this is going to affect our parents and our senior loved ones. We view, at Senior Helpers, the Class Act as a potential to offset significantly some of the coming reduction in state-level services at the Medicaid level, for instance. We do also see a doubling of the retired population as baby boomers begin to retire. Actually, this year is the first year that baby boomers are beginning to officially hit the 65 and older demographic. We view that population doubling in the next 10 years. And so we see, therefore, a doubling of need in terms of quantity. But we do not see the resources there to support that need. And there's a great deal of concern in the elder care community about that.
Jim, how popular do you think this is going to be once people start to realize that this is out there?
Well, it's going to be, I think the more people, working people, see what their parents are going to be going through, the more popular it'll become. It's easy to sign up for. It's optional. You don't have to do it. Your employer can sign you up if your employer chooses to participate, and they don't have to participate. But if they do, and if you do, it's easy to participate in. And if your employer doesn't participate, you can still participate. So it's a very flexible program that's so easy, and the pay-in costs are so low compared to the benefit that it would be insane not to participate, frankly.
And how do you participate? How do you sign up for this? Who do you have to speak to? Do you have to talk to the state? Do you have to apply with the federal government?
Well, those details are being worked out as we speak. The law, the Class Act law, requires the Secretary of Health and Human Services, the U.S. Secretary of Health and Human Services, to have the details of the plan hammered together by October 1st, 2012. And that's when we'll know what the actual mechanics of actually participating are going to look like. That's when he or she will have the premiums established, the mechanics of opting in or opting out. There are some things that we do know. One is you have to be 18 or older, and there's a vesting period of 5 years, meaning that you have to pay into the system for at least 5 years, and then you're fully vested, meaning you get the entire benefit. 3 of those 5 years, you have to be actively working, meaning if you join this program just before retirement, you have to work for 3 years of those 5 that you pay in before you become vested. But the details of how to opt in and how to make the decision will be published later on.
Well, Jim, I want to thank you so much for joining us on the program. Some very useful information there for seniors.
Thanks,
and I'm sure we'll chat with you again in the future. Jim Steele joining us, owner of Senior Helpers of Londonderry, about the Class Act as part of the National Health Care Reform Bill. When we return, Kevin Gray is in studio. We'll talk with him about the NBA Finals.